Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist who is quite tired, and it's late. As you can see by the darkness in the room, it is late. I'm tired, but I just had like an hour and a half, 2 hours of amazing interaction with a super rock star acupuncturist. It was a pleasure to be able to talk to Dr. Debra Betts, and I'm speechless really. It was just amazing. I will break down the interview and try to just give it to you like bite size, because we spoke a little bit about practitioners and even for the public as well, and even for midwives too. So I'm going to try and break down the interview that it's easier for you to get kind of the gist of as we were talking about it. So please hit the subscribe button, hit the notification bell, so whenever a new video is up, you will be the first one to know, and then you can just put the series together and get the full interview. I will release the full interview. I'm not holding back. We had a great time, and we got to go through some really important questions as a practitioner, but also as a patient or someone who might be thinking about acupuncture during pregnancy. Is it safe? You know, what are the questions that are out there? So we got to talk about all that. But first, I got to ask Debra just to give us a little bit of a background of what she is doing at the moment, because we know she's really busy, because this was difficult to arrange. But I just wanted to hear from her what exactly she is doing at the moment. So without any further ado, let's go to a split screen and hear all about it from Dr. Debra Betts.
Well, for a start, thanks for organising this, Sandro, and taking the time to want to talk about this pregnancy acupuncture. At the moment, well, I'm organising lecturers, getting my lectures together, because I'm going to be in Vancouver, where you're going to be as well, and Rothenburg. And just I'm working with students online who are doing a master's program here in New Zealand, and trying to write up some long overdue articles about the work we've been doing at the Hut Clinic in terms of providing acupuncture, and a survey of acupuncturists in the UK. And I'm also working on an article with some physiotherapists about the treatment of acupuncture and pregnancy. So I have a little pile of things I'm hoping to get through. Life is always interesting, I think. It's such a fascinating field for me.
Because you were saying that you're just back from Australia, where you were teaching, wasn't it, with Sabine? You were teaching there.
Yeah, it's a fantastic opportunity to work through the China books there in Australia, to work with Sabine Wilms. So Sabine Wilms is a historian, and so basically looking at historical aspects of what was in the classical texts of Chinese medicine about pregnancy, and then I was sort of trying to bring in some clinical relevancy of what's relevant for that for today. So a really great 2 days in Sydney and Melbourne. So it's good.
Because I got the opportunity of watching. Was that the first time you did it together at the IFS? The full day lecture? Yeah.
So we started off doing it as a 3-hour talk when we were both in London, and it turned into then a day, and now we then had 2 days.
Yeah.
So we've kind of we find a lot to talk about. So.
And you got great feedback from that day lecture at the IFS. I got to see some of it. All the feedback, I got to see all of the lecture because I was sitting there in the front row. But I got to see. I remember. I got to see some of the feedback, and it was really good. And it kind of goes. It went really along what Siobhan and I talked about, which was, for us, it was like the first time of having those two ways of looking at things, and it was so interesting to have. You know, the way that you swapped and changed, where Sabine would talk about something and then you would put the obstetrics into it, or you would talk about it and she would give the, I suppose, the historical vision on that. It was really good.
Yeah, thank you. It is recorded online, so if anyone wants to look at it through.
I was going to ask you that. Yeah, should have Lauren here online as well. I'm pretty sure that I did see that that recording is still available, and it's Really, really highly recommend it. Yeah, I know that I know that Sabine has a new book out. I'll try and look for it, and I'll leave it. I'll leave the details
Ah,
here. But the
I've only
talking,
just started reading this book
yeah,
because it's only just out, so I got to read some on the plane. And I know Sabine's hoping that it will have a wider readership of rather than just only TCM practitioners, because it's, you know, the most important chapter of the Suen 5, which is sort of the foundations of our medicine, and it's beautiful and it's full of a lot of things I hadn't really thought about. So I'm very excited. Yeah, I will be reading that book and thinking a little bit more about some of the translations.
So talking when we talk about books and we talk about obstetrics, it's always your book that comes to mind. And I know you're humble, but it's true. Your book is pretty much in every clinical acupuncture clinical practice that you can think of. Can you bring us back to what got you to write the book in the first place?
Yeah, it was really because of the work I was doing with the midwives. So I was teaching midwives short courses in acupuncture so that they could use it in their practice because they asked for it. From what they were seeing when the woman had had acupuncture, they were seeing these really interesting results in terms of efficient births. And they learn a very small amount of acupuncture, and they were getting such good results and coming back to me with such positive feedback. And at the time, in the acupuncture literature, there was a lot of fear and a lot of don't do this and a lot of you can't do anything about this. And so it was really an annoyance factor of people need to know about this, and they need to know that acupuncture can do so much in pregnancy that wasn't then very well recognised.
And
So
I
we
said,
had people like Sarah Budd in her, you know, National Health Clinic in the UK, but the actual written documentation was not very thorough. So it did take a while. It took years, and I was working with Peter Dedman, who was a very good editor. So I really think of it as our book because there was a lot of rewriting that went on over several years to get it, you know, to be quite readable. But that really was why, and that's why in the book there's lots of little case histories from midwives, because they inspired me to really let other people know what they were doing. Yeah.
yeah. So I always end up looking at your book. It's really strange to see the reaction in the clinic. So, you know, even to this day, it happens. And I don't know, you probably don't remember, but last year when I had the honor to introduce you at the IFS, I mentioned that it is.
Of course, I remember, Sandro.
No, I
And there's a
remember.
photo
I mean, no, I mean, remember what I actually said, because it was something that, excuse me, it just came to me when I was there. Is that it was strange, first of all, to be there on stage, you know, to introduce you, and thinking about, yeah, okay, so this is you, but your book is pretty much in every clinic of any other person who I know is an acupuncturist, and we just. I don't want to sound bad, but we just kind of take it for granted because it's like, yeah, acupuncture for pregnancy. Yeah, everybody knows that, you know, it's used during pregnancy. So what? But our patients don't actually. You know what I mean? Like some of the patients still come in, and if they do look at the book, or if the conversation goes into acupuncture during pregnancy, there's still a lot of people that would go, really? Acupuncture? Can you do acupuncture during pregnancy? But then we know you and we know the book, and it's like, how come you don't know about this? What is your experience from the practitioner side, from the patient side as well? Is it still like that? Are people still surprised about acupuncture during pregnancy, or have you seen a major change? Where are we at?
Yeah, well, I think that's great that you're saying practitioners just assume that that's viable, because certainly when I was training, it was not. It was seen as something to stay away from. I live in a little bubble. So I live in a little bubble, and I live in an area of New Zealand where the midwives have normalized it over the past 15 years. It's kind of accepted. The hospital provides needles for midwives to use on the wards. We have a clinic in a hospital. We've had that for 10 years. So it seems to me that it's quite accepted. And when I was looking at doing my PhD research, I would have liked to have done something around preparing women for birth, which is something which the top treatment that the midwives really find useful. But I couldn't have done it in this where I live because it's so normal. The midwives do it, acupuncturists do it. It's well talked about in all the antenatal classes. I wouldn't have been able to find a control group to have another intervention. So it's quite normal where I am. I don't know in other parts. When I travel and lecture, it seems that people have busy practices, so they're coming back for more information. And whereas a few years ago they might have had a small practice with a few people, they're now coming back, and it was great. In Australia, one of my questions is, how many of you have 50% of your practice treating pregnancy? And these people put up their hands, and then I said, oh, that's great, half a class. And then someone said, well, what about more than 50%? And I said, oh, that's even more wonderful. So, that's because that's my experience is once people know what you're doing, you can build a real practice around using acupuncture in pregnancy because there's such a demand for it once people know what you're capable of. So hopefully that's just growing and growing. That's the time that's happened to me, that it's kind of people are having these full, not only just fertility, because it's well known that acupuncture is useful for fertility now, but that people are actually having these really full pregnancy practices.
So that's why I was asking you, because as you know, Siobhan and I, like most of our work is in fertility, but it's or anything to do in the fertility field. It could be even just gynecology, and then eventually leads to it. But it's patients would take that way more. Patients would accept, I suppose I'm going to use that word there, a little bit easier that, you've been for acupuncture before for, gynecology reasons. The next thing would be, for fertility as well. But still, when it comes to acupuncture for, during pregnancy, it's still kind of like, oh, really? Oh, you can do that too. So that's why I was asking you, because from our perspective, it's just like, yeah, of course. But we have to realize that as practitioners, of course, we know about you and your work, but the patients don't. So that was why I will confess, and since it's actually recorded already in an interview I gave to another YouTube channel, that you are actually the one person that I did say, and we had this conversation before, that whenever I get you to come on the vlog, I can just close the YouTube channel and just go, that's it. That was the only person that I wanted to come on the vlog to talk to, because I just wanted not only my patients, but people here in Ireland and everyone then that actually knows about the vlog now to know from you that it is pretty normal and pretty natural to treat during pregnancy.
Yeah, what can I say? I mean, really, why should women suffer? So problems that people are told are normal in pregnancy, just because a lot of people have them, the back pain, the heartburn, the digestive problems in terms of the constipation or the vulval varices.
So that's the end of the first part of the interview with Dr. Debra Betts. I will release the full thing. I'm just breaking it down just because it's easier to upload, and then it'll be easy for you as well to just put the series together and get the full gist of what we talked about. I can only repeat myself by saying that I had a great time, and please, if you have any questions, get in touch with the OBAA, the Obstetrical Acupuncture Association. We're more than happy to pass on the questions to Debra, or if you want to get in touch through the Acupuncture vlog, that's fine too. I will just send them over to Debra or to anyone who you might have questions about obstetrical acupuncture. And if you want to know more about the association itself, that's fine too. Get me on the email, and I'll send you all the details that you need to if you want to join the association. The registration for the event with Sarah Budd here in Ireland is open, and you know that co-president Emily Solomon is going to be at a live Q&A session on the Saturday, and Debra is going to be on a live Q&A session as well, but on the Sunday. So the registration is open. Please feel free to go on the website and check that out, and it's going really well, so I'm really wanting to give Sarah a really, really nice welcome here in Dublin. So if you have any questions, please get in touch. This was part 1. There's more to come. Please subscribe, all that sort of stuff. And until next time, be kind and be healthy.
Oh, baloney. The whole thing always gets back to drugs.